Okay, so it is now, let's see, Tuesday, Wednesday, Thursday, day 10 into my recovery after a breast reduction. I'm going to start with, for the most part, I'm healing very well. I keep getting really bad shocks of pain that are going throughout my breast. Nipple sensitivity returned, I want to say, 2 to 3 days after the surgery, which was unexpected, in my right breast. However, my left breast is still numb. But like I said, internally I'm getting a lot of sharp shooting pains, which apparently is good because it means that the nerves are trying to reconnect. What else? Let's see. So, day of the surgery, I go into the hospital. I think it takes all of 20 or 30 minutes to get all my information, whatever it is that they need. And then they have my fiance come back to the room. And, well, he's back there with me. We hang out for like 10 or 15 minutes. And then they bring me over to the surgery part of the hospital. They leave him in the waiting room. And I'm there for maybe another half hour. While I'm there, I meet the anesthesiologist, who was really, really nice. Then resident introduced himself to me and explained that he would be in the OR during the operation. I don't know if he was going to be performing any of the surgery. My surgeon gets there about 10 minutes before the surgery's to begin. He, comes over and he's like, "Do you have any questions?" And that was it. And then they wheeled me into the operating room. They asked me if I liked music. There was some kind of music playing, and I'm like, yeah, I like all music. And that's the last thing I remember. I don't remember anything else. They had me shift over from the bed they wheeled me in onto the operating table. And that's the last thing that I remember. I don't remember anything else. I don't remember them mentioning doing an injection. Nothing. Next thing I remember is waking up in the recovery room. I was supposed to leave, I guess I got there around 11:30, 11:45. And I was supposed to go home by 1 p.m. I was there until almost 7 o'clock because every time I sat up, the dizziness was just overwhelming. I'd get really, really nauseous, and apparently I'd lose all color in my face and lips. So, 7 o'clock, they let me go home. I think I did one post-op video so far, so fast forward to today. Like I said, about 10 days into the recovery. I hate my surgeon. I'm going to put that right out there. He did a fantastic job on the surgery itself. However, as friendly as he is, he doesn't spend any time with patient care at all. He doesn't learn his patients' names. Each time I see him, it's, "Hi, sweetie. Hi, doll. How you doing there, cutie?" Whatever it is, but it's all nicknames because he doesn't want to learn your name, first of all. Second, I've spent a maximum of 11 minutes in total with him, not counting the surgery, anytime I've ever met him. I met him one time post-op, or pre-op, and the entire consultation took about 5 minutes. Sat up on the table, had the gown on. He came in, opened up, and asked me what size I wanted to get down to. He looked, and he goes, "So we're going to be putting the nipple up here. We'll cut from here to here and stitch everything up. And that'll be about it." And that was the entire pre-op meeting. Consultation. That was it. And so then I saw him 2 days post-op. I was supposed to take my first shower on Thursday night. The surgery was on Tuesday. So Thursday at midnight, so technically Friday, I get upstairs with my husband, and we're in the bathroom, and I'm undoing all my bandages and wrappings and everything, and I'm taking everything off. And granted, I am not a person who gets queasy. I watched the breast reduction surgeries the day before I went in for the surgery, so I'm not saying that it's impossible that that's what happened, but all of a sudden I'm standing there in the bathroom and I became overwhelmed with dizziness. I became disoriented and violently nauseous. Like, I wanted to throw up so bad. I bent over the toilet and I stayed like that for a good 15 or 20 minutes. I called the doctor and explained what was going on and asked what to do, and he told me to postpone the shower until I could come in the next day and meet with him and see what was going on. He told me to put the soft post-op surgery bra on, which looks like a soft pink sports bra. So I went to go put that on, and it started rubbing against the stitches, which hurt. So I removed it, put the ace bandages back on, and saw him the next day. I went in, again, he spent a maximum of 3 minutes in that room with me. Me and my husband were sitting in his office, in the exam room. He comes in, opens up the flap to my gown, takes a look, and he goes, "Oh, you're healing beautifully," and proceeds to walk out. I'm like, but what about the nausea, the dizziness? He's like, "Well, just go ahead and shower as normal." I'm like, "Yeah, but, what if I'm dizzy?" He goes, "Well, when that goes away, go ahead and start showering. Otherwise, that's it. You're healing great." So, this was Friday. I still wasn't myself yet. Saturday evening, I actually started feeling a lot better. I took my first shower, which was awesome. However, when I undid all my bandages, I noticed there were a black spot underneath my breast, which would scare anyone. It's a black spot on your skin. So I'm like, maybe it's dried blood or something. So I went ahead, took a shower, and after the shower, everything was looking really good. There was still a lot of yellow on my breast, and I didn't know, because they were still pretty numb, if that was bruising or if that was from the anesthetic that they rub on your breast for the surgery. I went ahead and checked myself out, and everything looked really good on the right side. Left side, there was a lot of, it's not even scabbing, it's just a lot of, like, blood right under the surface of the skin that was not showing on the right side. So, other than that, over the last few days, my right side has become extremely sensitive. Everything feels like sandpaper against it. My left side's still numb. I was scheduled to see the plastic surgeon for my post-op exam yesterday, and I was going to call to reschedule because we didn't have money for the parking. So I called, and the receptionist tells me, "Yeah, we could reschedule. Wait a minute, there's a note here that says that you need to come in and have stitches removed, so we can't reschedule. If you can come in today, we need you in here." So we drive almost 40 minutes up there. I sit in the waiting room for another 45 minutes for another 4-minute exam. I go in, and he takes a look. He goes, "Well, everything's healing great. How are you feeling?" I'm like, "I'm feeling a lot better." He goes, "Any discomfort?" I'm like, "Well, yeah, I'm still there's still pain, which is to be expected." He starts making sarcastic jokes all of a sudden. He's like, he goes, "How many months has it been?" I'm like, "It's been a week." He's like, "Oh, and you're still sore?" He goes, "Imagine that." And I'm kind of pissed because I'm like, dude, this isn't fucking funny. I don't find this amusing. This is frustrating me because I'm trying to be serious. I'm trying to get answers, and you're not providing any information at all. But then you'll mock me for the pain that I am feeling. You know, surgeons see 10 to 20 patients a day. They're used to it. It's fucking routine. You go in and out. It's not a big deal to them. For the individual going in for a medical procedure, when it's medically necessary, not just cosmetic, this, like me, is their very first time going through it. Try having a little fucking compassion, a little bit of human decency to say, gee, maybe it's my job as the surgeon to make sure this person feels confident and comfortable enough to go through with this. And then walk them through it afterward to make sure they know they're healing the way they're supposed to so they don't start panicking and freaking out like I did when I saw a giant black spot under my breast. So, anyway, he looks and he says that basically that black spot is dead skin. Or, not dead skin, blood that's pooled under the skin. And that over time it will just fall off. So then he goes to, he's, as he's walking out, he says to me, he's like, so no running for another 2 weeks. And, just continue wearing a soft sports bra. And he was ready to leave, and I had to stop him. I had to ask him, what about the results from the biopsy? I had to ask him, you know, about the asymmetry, because my right one is smaller than my left one, which I was told they were going to correct in the surgery. I'm not getting any clear answers from him, nothing that says this is normal or that's normal. Everything is very, very vague. So, as far as the aftercare treatment, as far as that, I'm extremely unhappy because I've spent a lot of this healing time concerned and worried that something isn't healing right because there are spots that haven't been explained to me. There is pain that hasn't been explained to me. I'm experiencing pain that I didn't expect. Not in the stitches, but in the inside, deep inside the breast tissue, I'm experiencing pain. You know, that's not something that I anticipated. And if you've never been through this, it's hard to know that you should. Other than that, the anesthetic is completely worn off finally. I'm up, I'm around, I'm moving. I still have to be very careful with what it is that I'm doing. I can't reach for things. I have to still be careful because if I overreach, I can feel the tension on my breast, which hurts. Like I said, my biggest issue right now is just the sensitivity. Holy crap. It was sensitive like 3 days ago in the sense that I had feeling in it. Now it's just, everything feels like sandpaper on it. Other than that, I guess it'll take at least 3 full months to see what size I will be. That was another thing. He never told me how much weight or how many sizes they took me down to. I was an E cup prior to the surgery, so I asked him, how much did you take out? His answer was, oh, we took out about 500, verbatim, he said. So you can expect to be a good cup or two smaller. That would still leave me in a double D. I don't want to be a double D. That's still too big. And I look down and I'm like, dude, there's no way. I look like a C cup. So I'm really hoping that he's wrong. Because on one hand, he goes, oh, we took about 500. And I don't know what that is. 500 milliliters? 500 cc's of what? Fat? Tissue? What? So he took 500. And he said, we removed a lot. I don't know what a lot is. I want in terms of cup sizes. What was the goal? What were you trying to get me down to? So I'm going to assume right now that his goal was to get me down to a C cup. I'm hoping that's what size I will be when all is said and done. Swelling on the right side seems to have completely gone down for the most part. Left side still seems, like I said, it seems bigger than the right side, so I'm hoping it's just swelling. Other than that, I'm doing pretty well. I still cannot wear the bra because it's just way too much contact. So that's about it. This is my 10-day post-op review. Surgery for the most part, very satisfied with. Surgeon, make sure that you do your research before getting an operation, even if it's through your insurance like mine was, because you need to make sure that you're confident and comfortable with the person not only performing the procedure, but that they put you at ease. And not only do they answer your questions, but they should be providing you with information, in keeping you completely informed. So that way, during the healing process, all you have to worry about is laying back and healing and not panicking and concerned about what these things are going on with your body that's potentially harmful or dangerous. So make sure you do research on your surgeon. When you meet him for the first time, make sure he pulls up a stool next to you and kind of takes your hand and is like, how are you feeling about this? And isn't rushing out the door to go meet the next patient. So, any of you going through this or preparing to, I wish you the best of luck. And I will probably do another post-op video. I'm going to say in about 2 months. This is mid-May. Getting married officially in July. So I'll probably do another video around August. That'll be 3 months after my surgery. And I will post some pre and post-op videos, and I will show you in the photos, I'm sorry, pre and post-op photos, and show you in the photos what I mean about the black spot. And I had like 7 or 8 people telling me to go to the ER because it looked like narcosis. Alright, so good luck, and I hope that this was at least somewhat helpful for anybody else getting ready to go through this. Bye.